Hello everyone. Today I thought I will discuss about the all important topic and the most frequently asked questions in our diabetes practice. How about fruits? It is said that there is no sincere love than the love of food itself. To eat is a necessity. To eat intelligently is an art. Diet and exercise are the cornerstone of treatment of diabetes. Among the diet, fruits play an integral part of our diet, and most importantly, it should form one of those healthy snacks. They are usually rich in vitamins, minerals like calcium, magnesium, potassium. They are rich in fiber, which helps in digestion. The phytonutrients and antioxidants are also a good part of the fruit. Fruit does contain sugar to varying levels. It mostly contains fructose and also glucose. Fructose otherwise also is called as fruit sugar and generally doesn't increase the blood sugar or the blood glucose much high. The choice of the fruit what we should take should be driven by the size of the fruit, the ripeness of the fruit. The riper the fruit, the sweeter it gets. So one fruit doesn't mean a small fruit, and the large fruit definitely does make a difference. Try to take fruits in the form of slices and avoid taking it in the form of juices, because large fruit or 2-3 fruits put together forms one juice. Usually juices are devoid of fiber, and because the liquid state of the nature of the juice, it gets fastly absorbed into the system and there is a spike in the blood glucose when we consume juice. So fruit is any day better than the juice. A warning for diabetic patients with kidney issues, especially if their potassium is on the higher side, we strictly say no to the fruits or the fruit juices, or those fruits with low potassium content can be taken. All these things, if you look back, are derived by the glycemic index. Glycemic index is a relative ranking of carbohydrate in food according to how these food affects the blood glucose level. The lower the glycemic index, the better it is for a diabetic because it has less excursions of the glucose. So the first step in control of food or the fruit is portion size. Watch your total calorie. If you happen to eat something which is more calorigenic or more sweeter, try and add more of protein. Try to reduce the portion size of the other carbohydrate like rotis or the rice, and do not forget to exercise. It's always wise to do a self-monitoring of blood glucose after taking a meal to know how much the fruit or the food has really affected us. It's also very important to know about the exchanges, means each food has an exchange or an equivalent component to it. For example, half of a bigger banana is equal to a smaller banana, is equal to 3 or 4 slices of mangoes, 1 handful of pomegranate, 8 to 10 pieces of sweet lime, 4 big slices of papaya, and few slices of peach, or 2 to 3 small pieces of sapota, because sapota will be much sweeter, a bit more of guava, and about 8 to 10 pieces of orange. So these are all equivalent. Even though watermelon appears very sweetish, the glycemic index is less and 6 long slices could still be okay. So remembering this fruit exchange is important. Fruits are an integral part of diet. Happy eating. If you know how much to eat and when to stop, it is never a problem. Thank you everyone for the patient listening.